for even a lot of the conditions where men and women have the same diagnosis, women are often diagnosed 4 years later on average. And so if we can better recognize what those signals look like in women, then we can help get them on the right care path earlier. Every single woman had at least one clinically actionable finding. The thing that ultimately catalyzed me to start Xella was an experience with my mother who had ovarian cancer. So it wasn't until it really affected someone that I loved where I really felt compelled to kind of devote my life to this and to helping to detect for women these conditions that are not diagnosed until too late, when it is potentially life-threatening, or, even if it just dramatically impacts quality of life.
Women are diagnosed on average 4 years later than men for the same conditions and wait 7 to 10 years for an accurate answer, while being told their symptoms are normal. Kelly Lacob spent her career building CRISPR Diagnostics and Mammoth Biosciences before co-founding Xella Health to close that gap, using multi-omic testing to screen for more than 130 conditions specific to female biology. She took it to market in June 2026 to a 15,000 person waitlist. I'm really excited to dive into this conversation to unpack the building of Xella Health to what it is today. Kelly, welcome to Reclaim. This episode of Reclaim is brought to you by Future Digital. At Future, we partner with the next generation of category-defining health brands to scale through paid media, lifecycle marketing, and performance creative. If you're building a women's health or family brand and you're looking for a growth partner who knows your category, visit Scale with Future to start the conversation. Now, let's get into it. Kelly, it is good to connect. It's good to meet you. I'm really excited to dive in and to have you on Reclaim, where we have a focus on women's health and dive into your story of building Xella Health to where it is today.
Thank you so much for having me. I love the podcast and I've listened to several episodes, so very excited to be here.
Oh my goodness. I probably should have asked you that before. Now I feel exposed. Well, let's start there. I want to start at the beginning, the origin of what really led you to seeing the gaps in women's health. We're in an interesting era where, we have the functions, the superpowers of the world, and I want to dive into your model, kind of how you landed here. But let's start at the beginning with what really drove you seeing the gap in measurement in women's health. I think it'd be interesting for our audience to understand what omic testing is and what really led to the birthing and the origin of Xella Health, and then we can build from there.
Yeah. So, it's funny. I have a lot of health issues myself. I'd say none major, but plenty of minor ones, where any one of them could have been something where now that I'm in the Xella journey, where I'm like, this could have been a motivator. Like I have early cardiovascular risk factors, due to genetically high cholesterol and, kind of high inflammation. I now know that I have PMOS, PCOS. I went through, fertility journey myself with IVF. I had an experience of pain during, sexual intercourse and didn't know what was causing that and thought there was something wrong with me for about 8 years before I found out a solution. But the thing that ultimately catalyzed me to start Xella was an experience with my mother who had ovarian cancer. And I think that's funny how as women, a lot of times is our natural role is to caretake and to nurture. And so it wasn't until it really affected someone that I loved. And of course, ovarian cancer is more serious, where I really felt compelled to kind of devote my life to this and to helping to detect for women these conditions that are not diagnosed until too late, when it is potentially life-threatening, or, even if it just dramatically impacts quality of life. And that's true across so many conditions in women's health. And I was very fortunate to have a couple of co-founders along who were equally passionate about that journey. And so shortly after losing my mother, we decided to really, give this a try and say, can we develop a platform level approach that can help women detect conditions earlier and get the intervention that they need to improve health outcomes? And so 2.5, almost 3 years ago now, that was the little seed that kicked it off.
Wow. That's a deeply personal story. And I would say selfishly for me and on behalf of the female population, like this is much needed and has been underserved. And I think we're at this interesting time where testing and diagnostics has also been more widely received. So help us understand the differences in what you're measuring, right? And there's also a lot of attention around, pre-screening for cancer, and there's preventative health, preventative tracking. You've got the wearables that have really expanded in the last 5 to 8 years, and getting all these data inputs. So help us understand what's different about the model that you've created, both with tracking data, but with support and guidance, with a fair volume of diagnostics that are currently in market.
So we're definitely in an era of the quantified self. People are measuring a lot of things, tracking a lot of things. And I think there are a lot of benefits to that in terms of, being more aware of your own baselines and just being more health literate and cognizant in general. However, there can also be detriments where if you have this data and you don't know if it's actually meaningful for you or the so what or the what next, then it's both limited in value and it can cause a lot of undue anxiety. And we've seen in the past, reaching back to examples like 23andMe, where, they were great pioneers in the space and, bringing data to women and men as well that they had never had before. But individuals didn't know how to deal with that data. And even the healthcare system wasn't quite ready to deal with it either. And so from early on with Xella, it was always part of our vision that we would be able to bring really robust data to fill these gaps, to help connect the dots between all these disparate pieces of information, and then have the so what, the what next connected to it, and have the care ecosystem built around it that would help support women to make sure that they're actually translating those insights into improved healthcare outcomes. So what do we do today? We do look at a lot of biomarker data, which includes proteins, hormones, inflammatory markers, metabolites, nutrient deficiencies, all these things across the board. And we also collect a lot of clinical data because without having context of symptoms and risk factors and history, a lot of those things are missing valuable context and information. And then we have built a female-specific knowledge engine in the background that is able to digest all of this information. And it's trained on clinical guidelines, emerging research, as well as a lot of proprietary assets that our medical and scientific affairs team have built around female biology and overlooked or underdiagnosed conditions. And so the result is that a woman is able to get a much more female-focused functional health analysis. And then we, at the same time, screen probabilistically using multimodal inputs and multi-omic data integration layers to say, what is the probability that you have any one of these over 130 different conditions? And these conditions range from female-specific conditions that have long times to diagnosis, like endometriosis, PMOS, fibroids, PMDD, to conditions that predominantly affect women, like autoimmune conditions, which are 80% in women, to conditions that occur in both men and women, but look different in women, and therefore are often not diagnosed as early. So early cardiovascular risk, as we talked about, different metabolic issues. And for even a lot of the conditions where men and women have the same diagnosis, women are often diagnosed 4 years later on average. And so if we can better recognize what those signals look like in women, then we can help get them on the right care path earlier. So all of that comes out in the report, as well as the interpretation. So why do we believe this? What does it mean for you? What are the kind of next steps for a treatment plan? And that can include both clinical interventions, so prescription medications, specialist referrals, as well as follow-up tests or imaging that's highly personalized. And then it's connected with a healthcare provider to actually help you take those next steps.
Yeah. Wow. So it's early days, right? You went to market last month. 15,000 person wait list. Is that accurate? Is that an accurate number that we pulled based on our research?
We had 17,000 women on the wait list at the time of launch.
17,000. Okay. So I'm curious, how did you build that list, or where did that list get built from over how long of a period?
Yeah, so I think we did a mix of organic and paid social media and then word of mouth. And I would say that the paid social media, we started maybe 5 months before launch, 6 months before. And yeah, if that, what was really incredible was that the cost per lead, so with the paid social media, normally in an industry like this, digital health or e-commerce, you would expect cost per lead to be somewhere in the $20 to $40 range. And we were seeing it around $6, which
Wow.
is yeah, very efficient. And I think it just really speaks to how much this idea, and even though we weren't very specific yet about what was included in the Xella platform, but women wanting to better understand what's going on in their bodies and wanting to have that support and connection between the, what's happening and what do I do about it and how do I do that. So that those were really kind of the messages that we focused on. And we talked about symptoms. We talked about things that are commonly overlooked. So pelvic pain, heavy bleeding, not feeling like yourself during what might be the perimenopause transition, the concern and anxiety that a lot of women have around their fertility and, wanting to know, are there possible barriers that I'm going to encounter, or what does my personal fertility timeline look like? All questions that we can help get to the root of with the Xella platform. So yeah, that was kind of where we were at launch. And then as we move forward, we'll have a lot of different other partnerships that are emerging, which is other ways we'll be reaching women as well.
Wow. I mean, when I came
Hmm.
across the number, and the number that we were looking at was
Hmm.
15,000, 17,000. That's such an impressive number. And I think on one hand, it's not surprising because the need and the
Hmm.
gaps are there and women are looking for this. And still that is an impressive number to be, launching with. And so I'm curious if you do want to go there, what has been the response in terms of, women saying, we're going to try this out and converting over. And I guess the second part of that question is, are there any limits to how you can deliver care at this time, since there is a care and the consult built into the model?
Yeah, great questions. So to answer the first, I'd say that it's been a little bit of a mixed bag where we've definitely had some good early traction, but we didn't have 17,000 women, convert all at once by any means. And so I think that one, there's lessons to be learned, and this is very normal in any kind of early launch phase around how we can continue to further clarify how we're different from other players out there on the market seem to be doing similar things. Um, I think a lot of it's storytelling, getting more women out there who have actually tried Zella in the early days and said, here's what I learned. Here was my experience. Here was what that follow up care really did for me. So I think that will just take a little bit more time. Also, the price point. So we're at right now $4.99 for a annual membership, and it is HSA FSA eligible. And so to think about that in context of what it would normally take to get precision healthcare or concierge level healthcare, it's terrific, but it's still not a small amount of money for many women. And so I think that it's a bigger decision and there's definitely a consideration period. And so those are all things that we're factoring in and learning from. And so also thinking about as we continue to evolve the model, how do we continue to make it more accessible? And we do have long-term reimbursement strategy plans, but there's different ideas that we're playing with right now about how even in the shorter term, we can make this more affordable, more accessible.
Yeah. Yeah. No, that was actually one of my thoughts when I was looking at Zella, was around what the nurturing and what the education is. Because when I came across Zella, I was like, well, I'm going to try this. But then I also knew that we were about to have this conversation. So I said, well, I have another access or insight into this. I'm certainly curious around what the education and nurturing has been in such a high trust category, in differentiating yourselves in a world of growing options, which is great for the consumer. Just from a communication standpoint, it's noisy.
Absolutely. There will always be certain pieces of care that are better delivered in person.
Yeah.
And so we do distinguish in our model, and it'll even say like in your platform or in your portal when there's different recommendations, this care can be delivered, virtually through Zella,
Yeah.
or, this piece is better done, with a specialist referral, but we can refer you to a specialist. Or, here are, if there's next steps that you do need to take on your own for, an in-person evaluation or to, measure something yourself, we'll kind of make it very clear and kind of here's how to go about those next steps. Here's any next questions you might want to ask, so on and so forth. But a lot of it we can manage directly through Xella. So our physicians, everyone gets assigned a dedicated physician who is longitudinal, continuous care with them. Those physicians are mostly OBGYNs. We have internal medicine as well. We do have access to some other specialists as needed. And
Mm.
they will both provide the, clinical summary and, kind of key findings, kind of recommended next steps. And then they're able to, as we said, do a lot of prescription medications directly over the platform. They can do supplements. They can provide recommendations for further imaging or follow-up testing. Most of the testing we can do directly through the platform, and same way you can schedule it the way that you did your initial blood draw. Sometimes we will recommend, going and getting a DEXA scan or a transvaginal ultrasound, which are steps which need to be done in person. But then we have a way to upload those results and kind of continue the care and the communication between the different physicians involved.
Wow. Are you seeing any patterns between, let's say, symptoms or concerns or even age ranges of the women who are, using Xella today? I'm curious also just now with so much conversation and attention around perimenopause and the menopause, and then also longevity is having its own moments. And curious if you're seeing, patterns between groups, population, ages, or topics of concern.
Yes. And so I actually just recently finished crunching some of the data from our beta cohort. So pretty hot off the presses here.
Yeah.
So we had about 50 women who participated in the beta. And
Yeah.
on average, every single woman had at least one clinically actionable finding, meaning that there was an action that could be taken that was supported by major medical guidelines. On average, 3.9 clinically actionable findings per woman.
Okay.
And within that cohort, in terms of domains represented for health, about 70% of women had something in the cardiovascular and metabolic risk domain. And about 70% of women, with some overlap, had a reproductive and hormonal health domain concern. And then there was about
Okay.
50% of women who had both of those domains represented, which I just think really speaks to the need to have a female specific preventative health approach because these things are deeply interrelated. So, and then in terms of ages, as you would expect, a little bit more of the cardiovascular metabolic risk in that kind of more perimenopause age population in between their 40s and 50s. But then you also had for the hormonal issues with a lot of women who are already on HRT, but it wasn't optimized for them. So
Oh.
issues like that. And then in the slightly younger population, the 30s to 40s, seeing a lot of hormonal imbalances, a good number of cases of undiagnosed PCOS, PMOS, things like that. And so I'd say those were some of the most common things we were seeing. But then
Yeah.
we also did see a number of nutrient deficiencies that are quite common, especially vitamin D and iron. So a lot of, women complaining of
Oh.
fatigue,
Yes.
that can be explained by their iron levels might be in the low level of normal based on a standard lab, but it's not optimal for women. And that can still leave them feeling very tired.
That's so interesting that you raise this because I was just having a conversation around normal levels, but normal levels when you do a standard lab test may be different if you're adjusting it for the female population. And so
Exactly.
is that right? So is that what you're seeing as well as what's being defined as normal is different on Zella's platform than if we were to do more standard lab testing? 'Cause- yeah.
Yeah. So we look at two layers kind of there. So one is yes, what most standard lab reference ranges look at is average for a population, which is a mixed cohort of men
Yes.
and women. What
Yes.
is normal for a woman
Yes.
might be different. That
Yeah.
range might be different. And then also what is optimal for a woman might be
Yes.
different. So we look at both the female normalized reference ranges and then
Mm.
also what is optimal. And so we will speak to both of those as part of our report.
I think that is such a key
Mhm.
factor because we're going out and about taking these tests, and then we think
Mhm.
we're in the normal range, but we're not even really based on our biology.
Mhm. Yeah.
That's so interesting, as I was just having these conversations and was kind of looking at lab test results.
And that's one of the things that honestly, I don't understand why the rest of the healthcare system hasn't already caught up with that because we know these differences exist. And that is such an
Yes.
easy change to make in terms of having separate reference ranges.
Yes, exactly.
Mhm.
Okay, that's so good to know. Where do you see, and this is, I guess it's still in the early days, but here's kind of where you see Zella fitting within the longevity conversation because you have, right? I mean, you've got different groups here in terms of, overly tracking, measuring, biohacking group, but then now women's longevity has also extended from that. So I'm just kind of curious where you see that at this moment.
Yeah. So it's a natural fit.
Yeah.
And we wanted Zella to be a home both for women who have existing concerns, chronic conditions, questions that have not been answered, or they've been seeking care and they've been dismissed or their needs not been met properly by the healthcare system. But we also believe very strongly in proactive and preventative healthcare, and that is longevity science.
Okay.
And so we do identify, risk factors for different conditions, ranging from cancer to a different, as we said, like cardiovascular metabolic concerns are the most common, but then other things as well. And so we will track and monitor those concerns over time. We'll also say in terms of optimal medicine, like how can we make sure that you're feeling your best and, not just good, but how you can actually be operating every day, feeling full of energy, you know, recovered and your muscles are recovered and you're feeling well into your health span increasing into your 50s, 60s and beyond.
Wow.
So it's definitely a huge part of the Xella platform. It's integrated into kind of everything that we do.
Yeah. Does the annual membership include, and this is actually a question that we'll get from our audience in terms of newer products and offerings in the market, but how much clinician coach care? Is that one session? Is that multiple sessions? How hands-on does one need to be since it is also tailored, for that specific person?
Yeah. So that was a tricky piece because individuals' needs do change a lot or vary.
Yeah.
So we have in the standard package that everyone gets, it includes at least one standard physician review, where they are going through your full report with you, all the initial findings, the initial treatment plan, and at least one follow-up to kind of check in on the plan and your progress, and if anything needs to adapt or modify. You also have continuous messaging communication at any time where you can message with your physician back and forth as many times as you need to. Beyond that, it does become much more personalized. And so we do have for additional consults, if someone needs to start a new treatment plan that wasn't included in their original plan, or they go and do additional testing and they get, additional follow-up test results. And that'll just be charged on an individual basis, just at cost. It's just a pass through to the physician. It's not much. It's about $35 per additional consult fee. In order to be efficient, we do a lot of this async, but also if someone does want to speak with their physician, either on the phone or a Zoom call, we make that possible because we know that some of our women are dealing with multiple conditions or multiple, complex treatment plans, and you want to make sure that they're getting the full support that they need. So we try to be as flexible as possible based on the needs of the individual.
Got it. I love that. And that's like simple and just very understand model. And it's also good to know that they'll get the support that they need or want, right?
Yeah, because some women, really don't need, every month to have a check-in. Some do.
Yes, I love that. Very simple and clear. I'm curious, maybe kind of switching gears a bit to building Xella to where it is today. Are there any key kind of growth moments and decisions? We have a lot of founders and operators and builders in women's health who are in our community. And in terms of key moments or critical decisions, whether it was landing on the business model, whether it took longer or took shorter, I'm curious, like surprises and the building along the way, before I kind of want to tap into your founder's instinct and whether you expect it to be a founder or not, right, along your path.
Sure.
Yes.
So I would say that business model was one of the most interesting ones where we kind of had whiplash along the way. When we started out and had our very first pitch deck for investors, we did propose a D2C direct-to-consumer model, thinking that, there are a lot of women who are hungry for this information. And we already saw the beginnings of more women seeking care outside of the established healthcare system to get that higher quality of care that they were seeking. And this was about, 2.5, 3 years ago. And most investors did not want to touch direct-to-consumer health with a 10-foot pole. They said, all the typical complaints about a direct-to-consumer business, the cost of customer acquisition is high and, it's very difficult and blah, blah, blah. And then in the couple of years in between, when we were in development and during that time, we were exploring a lot of different models to the market. We looked at employer benefits for a while, but then that space is very fragmented and crowded, and they don't want, many point solutions, and they want more data and evidence before, they'll really they're moving to a state where they want more data and evidence that it's actually going to help save them costs as opposed to just being something where it's going to improve employee satisfaction. We looked at payers and being a digital front door where we can help to do risk stratification, because we do a lot of risk stratification with our data for understanding who's at higher risk for different conditions and who might benefit from more focused or comprehensive care in a certain area. So we looked at that, and we looked at the B2B model for working directly with providers, basically all over. And then during that time, companies like Function and Superpower, came out and showed very clearly that a consumer health model can be very successful. And so then all of a sudden that tune changed. And so where we are today is that we are leaning into the consumer health model initially, both because we do believe that it is a very strong channel and it allows us to have a lot of full control around the end-to-end patient experience. But we are still very interested in, particularly in B2B, working with other clinical providers, because what we've really built at the core level of differentiation for Xella is this AI infrastructure layer around women's health and biology and this kind of care plan development and care navigation that provides a much more personalized care experience and can make care much more efficient for a provider.
Yeah.
And so, and at the end of the day, we can feed in, biomarker data, whether that's from somewhere like Quest and LabCorp or, somewhere that they've already gotten their lab results done previously, or the genomic data. And our engine can work with all of that. And so we are exploring partnerships right now in B2B that would allow us to be more of a technology software as a service model to these different providers. And it allows whether it's a OBGYN or a GP in a different environment to have that more precision healthcare approach that they may not have had all the training in, or, to look at the holistic, body, like not just the one organ system, but how do we think about how all these different things are connected and have a comprehensive care plan and then support as needed, kind of hub and spoke, connections to specialists. And so I'm very excited about that future potential. And I think we're starting to see a lot of interest pick up in that space as well, as more clinical practices say, how do we make use of data to provide earlier detection and more personalized care for our patients? So I think the future's our oyster. There's a lot of different opportunities out there still. And we will see a lot of growth in multiple directions for Xella over the next couple of years.
I love that. And that sequencing makes sense in terms of D2C owning the customer data and having more control with how fast or the pace at which you're growing while you're building out B2B. And we see this with other brands that we support as well. So that makes so much sense in terms of sequencing. I get his earlier days. I'm curious, since this was mentioned in terms of acquisition costs, are you surprised at your acquisition costs given the wait lists that you've built up so efficiently? I'm curious how that is tracking. I mean, we certainly see as the brand grows and scales, the acquisition cost does get trickier unless you're building out own channels, you're building out other channels and content organic to feed it. But kind of curious where that is sitting for Xella right now, if you want to go there.
It's honestly, it's a little too early for us to know since we've only been, about a month on market. If even quite that yet. I think we're about a month now. Yeah. So I'd say that it's looking promising towards, what we kind of forecasted, where we should be able to return the cost of customer acquisition, within that first year of operations with an individual. But you'll need to give us a little bit more time for us to really see how it levels out. I think it's too early in the early days to really know.
That's fantastic though. And you're meeting such a need that I think, that's fantastic if those are the early signals. Did you expect to be a founder along your way? And the reason why I ask is because when I hear your personal story and your mom, thank you for sharing so openly, to me, and also with the timing of what the world needs and the capital flowing towards women's health, to me, it almost seems like you found your life's work. And I'm sure that will iterate over the years, but I'm curious if you had a sense of whether you wanted to be a founder along the way. We have a lot of female founders in our community and kind of what that inner journey and expression was like for you.
Yeah, it was not the plan. And I grew up in Silicon Valley, and I was surrounded by the founder lifestyle and VCs and all that kind of stuff, and did not want to go that direction, honestly. Okay. And I've heard the saying where people, they're like, "Don't be a founder unless you really can't imagine yourself doing anything else because it's exhausting, it's miserable, like all this stuff." And so, very early in my career, I actually kind of went the polar opposite direction. And I worked in nonprofits and I worked in public health and global health. And it's very much one of those stories where I think it was Steve Jobs that said, all the dots connect in hindsight in, 2020 vision. And so I messed that up a little bit, but you know what I mean?
Yes. Yes.
So, yeah. So after I worked in public health and global health, I did get really interested in the role that technology could play to improve healthcare outcomes for underserved populations. And so I moved into healthcare technology, and I was a product designer and a product manager, and I worked for across a little bit of med device. I did some work in diagnostics and digital health and tech-enabled services. I was a little bit all over there. And I did end up at one point, after I had spent several years in an early innovation incubator, focusing a lot on, unmet needs, designing new healthcare solutions, developing the MVP, validating them, and then I was seeing a lot of both from our portfolio, but also just other innovators, social entrepreneurs in the space where their innovations would go through that valley of death period and they would fail to successfully scale and be sustainable and grow. And so I did decide for that reason I wanted to go to business school and I wanted to own products through their life cycle and really understand how do you make them successful and sustainable. So I did that, and I went to Stanford GSB, the Stanford Business School, which is known
Okay.
for having a highly innovative community and a lot of startup founders come out of there. But even when I was there, it was not
Yeah.
part of my game plan. And it really wasn't until I went through this situation with my mom and then I happened to have two co-founders, approach me who I had worked with them before. I respected the hell out of them. I trusted them.
Mm.
They're both a bit older and more experienced than I am. And so that helped. I did have a little bit of imposter syndrome for sure in the beginning, but it just came down to, I was like, this is a problem that I am so passionate about. I can see myself spending the next 10 years at least, if not, my life, devoted to this. And I don't see another good solution out there that's solving this
Yeah.
problem. And I think we have an idea that could actually make a real difference. And if that's not worth, committing yourself and taking the risk and trying to make something beautiful come out of what my mom had to go through,
Yeah.
then what is?
Yeah. No, I can hear the conviction when you tell that story, and I have goosebumps when you tell that story. I know you've been kind of sharing along the way, what's next for Xella Health, and there's so much that you can create, especially in your earlier days. Anything else that you want to share before we go into our last question, which is around reclaiming, right? Like, what is it that you're helping women reclaim? What's next that you're most excited about that we haven't talked about yet?
Yeah, so I'm really excited about some of these partnerships that we are developing. And I
Okay.
can't say the names for all of them yet because some of them we're still,
Okay.
getting the ink on paper. But for a lot of them, we are looking at how do we start really building the data that shows that Zella is making a difference. We
Mhm.
we have designed it in a certain way. We believe it will, but to actually prove that out. And so we are working with different types of clinical providers, some in the fertility space, some in menopause, midlife care, some in different subspecialty focus areas. And for each of them, we are looking at different metrics and saying, can we show that that we can find conditions that patients were not previously aware of? Can we get them on a more optimized treatment plan? Can we get them to treatment sooner? And can we show that we're also saving physician time and making their journey more efficient during this? We're also doing a couple of academic collaborations with different partners where we're getting a little bit more into long-term research projects, longer
Mm.
term, I should say, where there's opportunity to really have new discovery around women's health to not just I think we're doing a lot of value by bringing, together what's out there, but has not been really made accessible to women, or as we said, connecting the dots. But how can we advance that needle even further and have new discoveries that are going to really change the nature of care for women? And so some of those are looking at new multi-omic detection models
Mm.
for conditions that don't have a good standard of care today, advancing those forward and getting more real world data on them. And then some of them are looking at better understanding ovarian aging and the impact on the body and what can we
Mm.
tell about not only the impacts on the body, but about egg quality and impacts for fertility.
Mm.
So um,
Wow.
as
Yeah.
all of our team, our co-founders and a lot of our other team members as well are science geeks at heart, and so
Yeah.
we're really excited about helping to add to the compendium of knowledge around women's health while serving
Oh.
women at the same time.
Mm, love that, and so needed. I've gone through my fertility challenges. I had actually my left ovary removed when I was 8 years old. So I've had my version of a woman's health specific. So I love that. I also got goosebumps hearing that. And actually that reminded me of something before we go to the last question, which is even right now in its earlier days, how understanding that every woman coming through is on their own timeline, how quickly are they realizing that Xella is having an impact, right? So, you had mentioned having their diagnoses and, getting clear on what the treatment plan is. But how long? Because especially if you're doing HRT, that could take a couple of months of kind of like waiting and seeing and like adjusting. And so kind of curious what the folks coming through have been seeing and experiencing, if there's been any patterns and themes to that.
Yeah, good question. So it depends, of course, because we manage such a wide variety of conditions, and some of
Yes.
them are pretty quick fixes. And you do adjust, a hormone protocol level, or you find a supplement that's been like missing from their diet, and they can actually start feeling that difference quite quickly. Others, like you said, might have a little bit more of an optimization period, or you do want to, for safety reasons, titrate up to the right level over time.
Yeah.
So I would say that it's very condition dependent, but the important
Okay.
thing is that you're not kind of left in the dark then to, wait it out. We are proactively checking in. We are, um,
Mm,
having that, okay, here's the plan. Here's where we're going to check in next. And like, here's how we're going to adjust and modify before that. And making sure that all of your
yeah.
questions are answered along the way so that you feel like you're participatory in your care journey. You understand what
Yeah.
we're doing and why.
Yeah.
Um, so yeah, again, maybe check back
That's
in a few more months when we have more
sure.
longitudinal data.
Yes. That's so important because just waiting and seeing, you're just working with this open-endedness. That's hard to work with, right? And it just makes it harder to like stick to as well.
One last thing I might say there is that the other part is the mental piece of it, because
Okay. Yes,
so
yes,
many
yes.
women have a lot of stress, anxiety around these conditions that like they just haven't had answers for so long. So a huge part is also just having the answers. We see that create a lot of reassurance and take off that mental load for a lot of women. So in that sense, some of it can be quite immediate.
Yes. No, that's so true. And just working with the unknowns and feeling settled around the whole process.
We had about, I think from the beta, about 81% of women in our beta had symptoms explained by findings,
Okay,
which
that's
I think is
right.
pretty
That's right.
incredible.
Okay.
Yeah.
Yes, that's
Hmm.
that's very high. Because the waiting and seeing and waiting to get identified and defined and clarified is just it's a very stressful period. So I get that. Something that I'm very curious about as platforms like Zella emerges
Hmm.
and you're so specific in how you serve and who you serve is the role where the primary doctor plays in the care system. Because we see a trend where folks having the primary or even having a primary that has been on the decline. And so I'm curious to see, or if you have thoughts or hypothesis around, Zella is going to primarily replace their primary care, or is it more working, adjacent to, but is it really needed? And that's something that I'm just kind of watching the space and thinking about as well.
We're thinking about that a lot as well, too. So I think it's very important that, at least at this stage, that we are not replacing primary care providers. And
Okay.
we need to have a way to communicate well with them
Sure.
and for them to be able to understand the results that is coming from Zella, for them to be able to ask follow-up questions of our physicians, for there to be that layer of coordination. And so we do have care navigators, kind of medical assistants who can kind of help with like, that
Yeah.
communication back and forth. Now, as we think about it a little bit longer term, I think there's a world, a possibility where it could become the kind of the primary care layer for women. I wouldn't rule it out, but I would
Mm.
say that right now, today, our focus really is on making sure that the primary care providers, any specialists that women are already working with, that we are working with them in partnership rather than in silos or antagonistically, for sure.
Yeah, that makes sense.
Hmm.
Okay, last question. What are you helping women reclaim? From my view, there's a lot here, but if you had to boil it down, what would you say it is?
Oh, I love it. I think that we are helping women to reclaim their sense of control. And that might sound a little bit cliche, but around what's
Yeah.
happening with their bodies. I know we always talk about, a feeling of control, but I remember both for when I went through my own health experiences where it was just so frustrating and I felt very powerless for, I went and saw multiple specialists when I was trying to figure out like why my hair was falling out. And I mentioned, when I had like the sexual pain and like there was stigma. And so I often like didn't even go and ask. And it's like I just was dealing with so much of those questions of what is wrong and, is there something wrong with me? And And so giving women back that sense of control, of knowing what's going on in their bodies and feeling empowered to be participatory in their care and to make decisions that can affect their lives, the way they show up in the workplace, the way they show up with their families, in romantic relationships. And not only that, but, with as also as a caregiver for my mother, where I had that same feeling of powerlessness, where it was, am I doing all of the right things? Do we have all the information that we need? And where we can help women and their families to feel like they have that support and that information that they need to feel confident making decisions moving forward.
Love that. Thank you. Thank you so much. I so appreciate the depth and the openness that you've been willing to go into on this conversation. And I'm really excited to share this conversation with our community.
Me too. Thanks for asking such insightful and thoughtful questions. And I'm glad we got to dig into a lot of the different areas of both what we know and are kind of working with Xella today, but also the areas where we're still wayfinding and where we're really looking forward to continuing to learn and co-develop with women and partners to make this the best possible experience for women that we can.
One more thing. Reclaim reaches founders, operators, and investors, building the future of health and wellness. If your brand wants to be in front of this audience, sponsorship slots are opening up. Reach out at support@scalewithfuture.com. The link is in the show notes.